When I was in 6th grade, I remember they said, why don't you, for the science fair, make a heart-lung machine? So we went to the grocery store and we bought these bottles. I had a syringe that could pump colored water through it. And I won the science fair at the Burr Oak Elementary School in Calumet Park in South Chicago. So that was when I was in 6th grade, and I still have the photo somewhere with my hair's all unruly. So I want to build something that's new and unique here. I want a balanced approach to cardiovascular care so that cardiology weighs in, cardiac surgery weighs in, sometimes vascular surgery weighs in, and anesthesia weighs in and says the patient's too high risk for surgery. And we all have offices in the same suite. And we all drink out of the same coffee pot, and we discuss patients ad hoc, and it cuts down half of the meetings that we need. You can't legislate goodness. That's something you can't legislate. And you can't dictate good medicine from the top. That has to come from the heart of the physician. You have to feel for the patient. My feeling has always been that if you provide the best care that you can for the patient, then you will get lots of patients because you're going to be the best and they're going to like you, and you're going to get a lot of patients. Every time I see a patient, I always end by saying, we'll take really good care of you. And then trust comes with that. Cardiac surgery is a relatively new specialty. It started completely from scratch in the late 50s, early 1960s. The ability to know the giants that started your field gives one a passion for being in continuity with them as you go down the road. I trained with a guy named Sir Magdi Yacoub in London. Magdi did the world's first valve-sparing aortic root procedure. I've been in Iran 5 times in the last 5 years. I've been to India probably 20 times. I've spent a lot of time in Turkey. So I've operated Africa, Asia, Europe, United States. It's a very well circumscribed field. You can know a lot about a pump. And we concentrate on the heart and the great vessels that come out of it, and that's my spot. And so I know that pretty well, and there's not many people that know more. So you can kind of completely know your subspecialty. Like, for example, I do coronary bypass grafting, I do valve replacements, I do valve repairs, I do artificial heart devices, I do cardiac transplantation, I do operation for the sac that surrounds the heart. And so I still have the ability to cover all the bases, the continuity to be able to actually learn from the guys that devise the operations, then be able to do it yourself. And then also be able to train. I've trained 40 fellows so far in my career. My passion is the aortic root and the aortic valve, and so I like to do aneurysm surgery and do aortic root surgery. So that's kind of my subspecialty, but I still have started heart transplant programs, I've started artificial device programs, and so I still do the other areas as well. The other life-saving thing that I'd like to bring to the DMC is something called ECMO, and it stands for extracorporeal membrane oxygenation. It's basically being on a heart-lung machine at the bedside. And this is for patients anything from drowning victims to patients in the winter who are hyperthermic and arrest because they're cold, or patients that have the flu and their lungs don't work. These are devices that can be put in for a week to a month, where you support the heart and the lungs and then slowly wean them off, and the patients actually live where all of those patients would have died otherwise. And in surgery, there's only 2 reasons we operate on a patient: quantity and quality. You're either trying to give them more quantity of life, or you're trying to give them more quality. Sometimes it's both, sometimes it's only one, sometimes it's the other. And so there's things that you do to make people feel better. You sit on the bed when you talk to them. We're in an empathic profession. If you don't show empathy, you're not going to succeed, period.